And now we're going to be talking about PA guidelines now. We're going to first look at pregnancy. Now, exercise while pregnant can be dangerous, so it's always best to do it at specific times. Now, when you're in your first trimester, which is in the first 3 months, you are able to complete vigorous exercise. The pregnancy doesn't really hinder you that much. When you get to the second trimester, it's between moderate and light, so you can do some, but you want to keep it short, so like quite a low RPE, at least RPE 5, maybe 7, so you don't cause damage to the baby and or tire yourself out too much where it can cause problems for the baby. The third trimester, so you want to be wearing light and loose clothing, so you really don't want to be exceeding RPE 2, maybe 3, so keep it a short session if there is a session, and keep it, if it's weights, light weights, or if it's cardio, just keep it slow and don't go for too long. Then after the fourth trimester, which is after the baby is born, you can start going back up, get your body back into shape if needed. With regular exercise, it gives you the chance to meet other mums-to-be. So if you opt in for a class where there's other people who are pregnant, that can help reduce stress because you can talk about your problems, people can give you some advice, help reduce your stress, which then in turn keeps you healthier, and then that might help you sleep better, which sleep is always needed to be healthy. Next to diabetes. Now, diabetes can cause a lot of problems in life, and if you are overweight, you are more prone to be getting diabetes because of the sugar intake. Now, if you do get diabetes, exercising can always help because you can help control your blood sugar levels, you can diet, you can, exercise is very good for you. So doing exercise, as you can see, she's not going to be stopped by diabetes. Now, exercise helps because it can lower your blood glucose levels very quickly, which again is good for the diabetes. It can improve the body's use of insulin, so that's very good. It makes your body more efficient as well. It reduces your insulin requirements, that's your sugar intake, and you have better control of diabetes. Again, if you're overweight and you start to exercise, you can maybe control it better. And it also reduces the risk of heart disease, so that's strokes or anything due to being overweight because of your cholesterol level in your heart. Your heart will also get bigger the more exercise you do, so that might help. And the next is looking at age. Now, age can affect the amount of exercise you do, and it's always good to do exercise as you get older so your body doesn't really take a toll from the aging. Now, when you get older, your spine and back may start to bend because the multiple years of maybe slouching or just your posture in general may be quite bad. So when you start to work out, you can actually make your posture better, which can also straighten out your spine, which reduces the risk of back problems or any back related causes. Now, osteoporosis is quite bad. Now, 1 in 2 women and 1 in 5 men will suffer a fracture after the age of 50. The reason it's more likely for women is after they get to a certain age and they no longer have their period, they have menopause. Now, this stops the growth and the strengthening of the bones constantly, so the bones are going to be more weak. So it's always good for women to start doing weight training at a certain age to make sure their bones stay strong and really resistant. Now, as you can see here, there's an elderly gentleman who is working out and is still fit, and so he will hopefully not have any heart problems or any joint problems because he's staying active and he's keeping his body prepared. And that is that.